guys, welcome back to my channel. My name is Casey if you're new here, and if you are new here, please make sure to like, comment, and subscribe. So if you read the title, you see I have officially graduated from my nurse residency program. Yes, y'all, I am no longer like a baby nurse. I am no longer under any orientation. I am no longer rotating units. I have picked my permanent unit, which is an intermediate ICU or a step down ICU. I'm officially like full-fledged RN. I mean, I've been an RN, but I'm fully fledged by myself. I'm no longer under a residency or a teaching program. So I'm like 100% by myself. And yeah, y'all, it's been amazing. I'm going to tell y'all the full ins and outs, my entire experience. And yeah, if you're interested in a residency or a hospital that provides a residency, I 10 out of 10 recommend. I was actually in the honors program of my residency program, so I'll get into all that and the details. I feel like yesterday I was just telling y'all like I failed the NCLEX and like that whole ordeal and just like going through the process of that. But y'all, I am officially graduated from my residency program, and I have been a nurse for a complete year. So my residency program was a full year, and like I said, I was in the honors program, so I did all 4 rotations, and I'm gonna break all this down. But yeah, this video is just basically to show y'all and tell y'all how my particular residency program went. If you're interested, please keep watching. All right, so I started my residency October of last year, so October 2023. Basically, the way that it works, so I was actually supposed to start in July of 2023, but if you know, then you know, your girl failed her NCLEX. But it's okay, because we're here now. I failed my NCLEX, and they pushed back my residency start date from July all the way to October. I was crushed, okay? Like, I was literally crushed. I was like, how can y'all push this date that far back? But as you know, you have to wait 45 days to retake the NCLEX. I retook my NCLEX, and I thought my start date was going to be August 21st. He said nope. He said we have to have like your nursing license like be processed on the board of nursing. It was like a whole thing. So I couldn't start then, so they pushed it back to October of 2023. So the way that residency works for my hospital, basically I work for a company. I don't just work for like a single hospital. I work for a company, and my company, they have hospitals all over North Carolina, and they have multiple locations in Charlotte, North Carolina, where I live. So the way that it was is you go to 4 different units or 4 different hospitals within that residency program based on your track. So they have different tracks. They have labor and delivery, they have emergency department, they have ICU, they have intermediate, they have med surg. So my track was intermediate and med surg. So the 4 places that I went, I did a med surg rotation, and that was in Huntersville, North Carolina, which is like right outside of Charlotte. My second rotation was at the Charlotte Orthopedic Hospital. My third rotation was in the ICU Uptown, or the intermediate ICU, which is where I work now. And then my 4th rotation was in oncology. I did all 4 rotations, and then at the end of it, you could decide to opt out at any 4 of those locations at any time and work as a fully staffed at any time at any of those locations. Or you could continue to do all 4 rotations, and if you do all 4 rotations, you have the opportunity to be an honors student, which I was an honors student, which I'm extra happy and proud about that. With being an honors student, you, at the end of your residency, you build a portfolio, you do a bunch of paperwork, and, you know, write a paper on what higher education that you want to get, or what do you want to do outside of being an RN. So it's basically for any nurse who wants to further their education or further their career path. I think they had a track for like CRNA. They had a nurse practitioner track, which I did. They had a track for, I want to say like education, a master's in education, a master's in like management, things like that. So like I said, I chose the nurse practitioner route, which I'll go into a little later. My first rotation was from October 2nd to around February 4th. And I was in med surg. So basically I got 12 to 13 weeks of orientation as a new grad nurse. I had 2 main preceptors, but when those preceptors weren't there, I would be placed with, of course, somebody else. First, I worked my 312s, and they were night shift. I did all my rotations night shift, only because you don't really get to pick. They kind of just place you. But the only reason I requested nights is because, and come on now, they always want people to work nights. But the main reason I requested nights is because even as a CNA, even before I was like a nurse, I always worked night shifts. So I was like, please put me on night shift. And so they put me on night shift, 3 12s a week with a preceptor. I had 2 great preceptors when I was in med surg. They were awesome. One of them I actually went to high school with. He was a travel nurse, and I went to high school with him. I didn't even know. I literally didn't even know him in high school or anything until we started talking. He was like, "Oh, I went to that high school too," and I was like, "Wow." But he was like a younger nurse, and then I had like an OG nurse, and she was like in her 50s. So I had like the best of both worlds for my first rotation. And for me, for my first rotation, I think starting off in med surg was the best thing I could have done. I did work at a smaller hospital for my first rotation. I like that too because it was a little more intimate. I got to ask a little more questions, way more questions, and it was at a slower pace. So I really enjoyed that. And I saw everything. I think med surg is a good basis. Like, I see why back in the day, I'm not saying that this is correct, but like, I know like back in the day, they used to say, like, when I talk to older nurses, they used to always say like, we didn't have any choice, like we had to start med surg. And I kind of understand why. Like, you get a good foundation, like a good basis of everything. I saw cardiac, I saw respiratory, I saw GI, I saw GU, I saw everything. We got a lot of bariatric surgeries there. I saw like ortho ordeals. I saw literally everything, y'all. I saw my first code there, my first rapid there. I saw literally everything at that hospital. Like I said, I was on orientation for 12 weeks, and then the last 2 weeks there I was independent, and I did pretty good being independent. Like, I got hit with a lot of stuff. I remember one night I had 3 admissions. I remember one night my patient was literally like tanking, and I had to call a rapid on her, and they ended up sending her to intermediate. Yeah, I learned a lot being there. Like, I literally learned a lot being there. And it was a great introduction to nursing. For my second rotation, I was at the Charlotte Orthopedic Hospital. This was totally different to me because it was very specialized. I will say at the Charlotte Orthopedic Hospital, I feel like I really got broken in as a nurse. My first rotation, me being like, it being my first rotation, me not knowing everything, that was like really acceptable there. But when I got to like the Charlotte Orthopedic Hospital, oh baby, they didn't play that. Like, they treated me like I was already a nurse for like 10 years. Like, they did not play the baby talk. They did not play baby nurse. No, you are a nurse. You have been thrown in, and you better know what you're doing. The only difference, orthopedics, and now that I look back, I will say, like, out of all my rotations, that was probably like my easiest. I hate to say easiest, but I think that was like, between that and oncology, those two were probably like my easiest rotations. Just because they're so specialized. Like, I feel like when you're really specialized in something, you hone into that, like, versus like what I'm doing now, working in the intermediate ICU and working in med surg. I think those were a bit more challenging, only because it's like you're doing everything. Versus when you hone in on something and that's like what you hone in on and that's what you know, then it's a little more like, it's easier because it's like you're just focusing on one thing. I guess that's what I'm trying to say. So I saw hip arthroplasties, knee arthroplasties, shoulders, spine, neck, hand, not really hands. We didn't really get too many hands, but yeah, we saw all of that. We get 6 patients that were pre and post-op. Some of them were preparing for their surgeries, and then a lot of them were post-op. We worked on an ERAS floor, which is early recovery after surgery. So they wanted all these patients up, working with therapy. Pain meds was a big thing on that floor, and antibiotics, of course, because after surgery you want to prevent any infection. So a lot of these patients were getting things such as antibiotics, and then pain meds were a big thing. Typically after surgery, they always did schedule Tylenol, but also like oxy and morphine would be ordered a lot. I didn't see a lot of Dilaudid, but you would work under surgeon. A lot of these patients had like drains and monitor their drains and remove different drains, hemovacs, stuff like that. After surgery, of course, they're on anesthesia, so they had a certain amount of time to urinate. If not, you would have to straight cap them and eventually probably put in a Foley. It was very different. It was a little more calm at the ortho hospital because it was very, like I said, like very honed in and very specific compared to like other places that I've been. Also, it's in like a lot of these, we didn't really get traumas until like the end of my time there, but a lot of these patients, honestly, y'all, they were elective surgeries. Like, a lot of these were elective surgeries. People kind of came in or went to the orthopedic surgeon and kind of told them like, hey, I need a hip replacement, I need a knee replacement. So when you deal with that, like these people have money, okay? So surgery has a lot of money. Those rooms over there were very nice. The patients were a little bourgeois. They had money over there. There were more elective surgeries compared to like traumas, because if you had a trauma, you were pretty much going to like, they had a trauma floor at the hospital, at the main hospital. So we didn't really like get as many traumas, but we were starting to. I know when I had left, I don't know if they're still getting any traumas or anything, but those were more so elective surgeries. It was a very specific patient population, and we would definitely see way more like older people over there. So that was my second rotation. I was there from February until April, and then from April to July, my whole summer I was at the intermediate ICU. It was very, very interesting, y'all. I would say I was very, very challenged there. And it was a total shift from going from med surg to critical care. So on that floor, we got a lot of ENT patients, ears, nose, and throat patients. They immediately come to our floor. Also, we would get a bunch of drips, and still do. That's where I work permanently now. But a bunch of drips. So things like Levofed, we get diltiazem, we would do Precedex, heparin, just a bunch of like different titratable drips. You see a lot of things like AFib with RVR. You see a bunch of chest tubes, a lot of oxygenation, BiPAP, OptiFlow, high flow, CPAPs, ventilators, trachs. Honestly, you see so much, y'all. So I was on orientation there for 6 weeks, and then I was independent the rest of my way. And I really, really enjoyed it. I really, really enjoyed that rotation. And even beyond like seeing everything that I saw, the patient ratio was completely different. So I only had 3 patients, only because they're so critical. At times we would have 4 patients on like crazy nights, or if we're short staffed, but most of the time they would ensure that we have 3 patients. Also, I feel like with that unit, I gained a lot of friends. Like I ended up being with like a lot of people and girls that helped me, and it was a really, really good unit and a good place that I wanted to stay. So even though I was doing my 4th rotation, I knew that I was gonna come back to the ICU just because the patient ratio was way easier. It's just like a good unit, I feel like, to work on, and to get that critical care basis is really good, because I feel like working on an intermediate floor is like right in between. So if I want to go back to med surg, I can, or if I wanted to accelerate and go to the ICU, hopefully I can. But I learned a lot, and it was like really a good experience to the point that I knew I wanted to come back. Out of all my rotations, I would say that was my favorite rotation. And my preceptor, me and her are really close friends now, and she taught me a lot about critical care. She came from an ICU. She was actually a travel nurse, and she came from an ICU. She worked in an ICU in DC, and that was her background. And then she came over to us. This is like her 2nd travel contract, and she was freaking awesome, y'all. My girl she knows her stuff. Like she really, really knows her stuff. So she taught me so much about critical care, and yeah, I was like, okay, this is the place that I'm gonna be. Just because it challenges you so much. Like before you do anything, you always think, like that's the type of floor you always have to think. It's a very nasty unit. It's a very fast-paced unit. I had my first personal code there. I've had several rapids there, and it's just a very fast-paced. It's a very hard unit. It's a very nasty unit, I'm not gonna lie, but like it doesn't compare to what you will learn as a nurse there. And I've learned so much information there just as a nurse. So I'm super grateful and thankful for the opportunity, and I love the just the learning aspect of it. I like that I'm always learning something every time I go to work. You got NG tubes, you have tube feeding, pegs, you just have like everything. I've literally seen everything there. AKA, we do insulin drips. Like I have seen it all. It's always a learning opportunity. It's always someone there to help you too. And it's crazy because that was the rotation that I was most scared for and most intimidated about, but I did it and I rocked out. And I told the manager before I left, I said, I'm definitely coming back here. And they made it a point to make sure I came back there. I was able to shadow respiratory therapy while I was there, and be placed one-on-one with the RT, and just learn different skills and learn, just different things about critical care. So especially being able to be with RT was great. And I'll get into all of that on when I opted out, when I was able to get that experience, but it was great, y'all. So that was my 3rd rotation. My 4th rotation, I went to oncology. Oncology was my hardest rotation. Not like challenging, but just like, y'all, it was the worst. I'm not gonna say it was the worst. It was just very challenging for me. Okay, so I did oncology from July to October. So first of all, this was my first rotation. They put me on day shift. I was on day shift, y'all, from 7 a.m. to 7 p.m. when I've been working night shift for the past 2-3 years. So that was the first challenge. Second, my preceptor was not the best. She was very opinionated. That was her unit. She was chemo stem cell certified, and in order to work on that unit, you have to be chemo stem cell certified. You don't have to be, but you eventually, if you decide to work there, you have to get your chemo stem cell certification within a year. So she was one of the top nurses for the simple fact she was chemo stem cell certified. Very complaining. She complained a lot. Kind of walked around entitled. It would be time for us to get report. She would leave me. I'm your preceptee, but you're leaving me. Going ahead and getting a report. It would be time she didn't talk to me. She wouldn't review my charting. She would make me feel dumb for asking questions like I'm supposed to already know about these different hundreds types of chemos, or I'm supposed to know about all these different types of cancer, because when you work on a cancer unit, it's very, very specific. It's not just breast cancer. It's not just leukemia. It's not just multiple myeloma. It gets very, very specific. You have B cell, T cell, you have like all different, like it breaks, it gets very, very technical. And one thing about those nurses over there, they're super, super smart. Like I will say that they are super smart. They're on their stuff. But again, it's like, it's the type of thing that you have to be doing every day in order to get very confident and competent in it. And I was only there for a short amount of time. I remember one time I was with my preceptor, and I'm not going to continue to talk about her because that's what, we're not here for her. Okay, I just want to explain why this wasn't the best rotation for me. The oncologist would be there during the day, and we would have to round the unit with the oncologist. And she was charge nurse one day, so we had a round. And I thought that was such a great experience just to see what the charge nurse does, and also just to see, you know, the oncologist's point of view. So I got to shadow with the oncologist, the pharmacist, and a nurse practitioner and a PA, along with the charge nurse. And I was precepting, so I was like just in the corner. So we were talking about one of the patients, and me and the charge nurse, we were able to take care of that patient that day. And she was having some emesis and some dark bloody stools. And so the doctor had asked my preceptor how the stools were, and she was like, oh, I didn't get to see them. And I had told her I went in the room to help the patient use the restroom, so I was able to see the stool. So I was explaining to the doctor, I was like, hey, like I was able to see, you know, her bowel movement, da 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 da. My preceptor cut me off and was like, she doesn't know anything. She's a resident. She doesn't know anything. This isn't her patient. She doesn't know anything. And so I just kind of like stepped back, because it's like, one, I'm not finna get out of character for you. Two, definitely not in front of an oncologist. And three, she has a lot going on. Like she was ADHD. She was just all over the place. And I'm not finna stoop to her level. Like, just continue to always stay composed. Always stay composed. Like if I can give you any advice as a nurse, like just always keep your composure. Stay cool in a pool of fire. Make them look crazy. You're not. Just stay cool. Stay cool. Always stay cool. Like it's no reason to be popping off at the mouth and doing all that. Don't stoop to their levels. So I just feel like my preceptor was a big part. But I learned so much on the oncology unit, y'all. Like I literally learned so much. There's so many different types of chemo. There's so many precautions to chemo, pre-meds that you give before chemo, after chemo. So the unit was divided into patients who were receiving like med surg type patients. They had a lot of med surg patients, like because it was a hematology and oncology floor. So they had patients who were just getting like, who may have had sickle cell, you know, just they're dealing with more hematology issues. And then you had the oncology patients who were receiving chemo. They did a lot of stem cell transplants, which was amazing. Oncology is it's a whole thing within its own. You have inpatient treatment. Some people are there getting chemo over a course of days. And then you got some people getting outpatient chemo and treatments, but you will get your treatments they have like a schedule course. So some patients are back maybe every 2 weeks, so that you really learn to know the patients. Some patients are there, you know, once a month or every 3 weeks, and they're getting treatment. So you really get to know the patient population. So actually I got to end up switching to night shift. One of the residents coming in, they had her on night shift and I was on day shift, and she needed to work day shift just because it worked with her schedule. So I was able to switch with her. Management allowed us to switch with her. So once I switched to night shift, it was way better. It was a little more chill. The main thing at night was like monitoring the patients. Did labs in the morning. So a lot of patients we would have to draw blood in the morning. Everybody had like a central line or a trifusion or some type of like central line, be it a port or whatever. We would access ports, things of that such. So a lot of patients were able to get, you know, treatment through their central lines and stuff like that. But one patient I took care of was actually my old classmate when I went to undergrad at Central, and then she ended up passing away. So I think that experience really stuck with me, and that was like one of the hardest things I had to do and to see like a 25-year-old go through cancer. That was one of the hardest things I've ever had to do. And it was very humbling, and it was just like a very like eye-opening experience. And I also believe like cancer is one of those things that can happen to anybody. Like, don't ever feel like you're not good enough to get it, or it will never touch you, because it will. It can. I'm not saying it will, but it can. So just always be like, just always be, grateful and humble. It was a very eye-opening experience. We had patient code on that floor my first day there, just because she wasn't getting her chemo treatments, and it was a lot. It was a lot. That rotation was a lot for me. You get to learn and grow with the patients and see the patients, and it was a lot for me, y'all. I'm not gonna lie. Like, you really get to know the patients. It's a more personal unit, and the patients get to know the nurses, and it's always beautiful when they get to like ring the bell at the end. But everybody doesn't make it out. In hospice, they work directly with hospice care, and it was a lot. So yeah, I was able to be independent on that unit. Not immediately. I was on orientation for about 12 weeks there. And I was independent for like my last 2 to 3 weeks. But being independent on that unit, I only could take like the med surg type patients. I couldn't take any patients who were getting stem cell treatments or any chemotherapy, because I wasn't stem cell or chemo certified. But that unit was just like mentally tough for me. I did, because like I said, I've always worked night shift, and then they had put me on days. But when they had put me on days, y'all, I'm not gonna lie, like I was late like 2 times, and then the manager, I had told my preceptor, I'm like, hey, I'm gonna be late. Can you give me a number to call the unit? She never gave me a number to call the unit. This is when I was working days. She never gave me a number to call the unit, and so I would just pull up thinking everything's okay. The manager ended up reporting me to the residency manager, and I got in trouble. I literally got in trouble. I'm not trying to justify being late, but I did like walk in at like 9 o'clock, and y'all know the shifts for nurses are 7 to 7, and you got to be clocked in by 6:45. So yeah, y'all, it just wasn't my thing. It wasn't my thing. But when I was independent, I took care of like med surg type patients, and there were more so like patients, like I said, like waiting on a cancer diagnosis. I worked with a lot of a lot of sickle cell patients who were getting like patients who were on a PCA pump and things of that sort. So it was interesting. Having med surg patients, you would get 4 or 5 or even 6 patients. I remember one night I had 6 patients up there. And then anybody working with like a chemo or stem cell patient, they would have like at least 3 to 4 patients, because those patients, they are on so much chemo. They're different bags running, pre-meds, non-rejection meds, and then you had like antibiotics going, regular fluids going. When I say their pumps would look like ICU pumps, and you have like all these different brands, y'all, it was so much. And it was during the day, and then finally when I switched to night, I felt a little better. But just day shift was a lot for me, and it was a huge transition. So I say all that to say, y'all, oncology is a world within its own. If you want to be an oncology nurse, I definitely highly recommend, because I feel like we need more great oncology nurses out there. They have outpatient oncology nurses who do chemo, and people come in for their treatments, and then they have like the inpatient patients who stay and have to receive days of treatment. So it's really interesting just seeing patients go through the process. Like, you see people walk in like so healthy, and then they lose their hair, and they're just like weaker when they walk out. And just even seeing the stem cell transplant process, like where they get their stem cells from, like if it's an allo or an auto transplant, y'all, it's so detailed. But beyond like all the personal stuff, it was beautiful for me to give myself away in that way, and to just be there like a vessel for those patients. I think it was amazing. So 10 out of 10 experience, but it was really like just mentally challenging for me. And I think that really broke me in as a nurse. So towards the end of that rotation, I knew I was going back to the ICU. I had already talked to the managers and everything like that. So my manager had reached out, and he had me on orientation for 2 weeks just to get back acclimated with the unit. And I went back to the intermediate ICU. I had my same preceptor, my girl, who helped me so very much. So I got acclimated with the unit. and then I was independent, and I've been independent ever since. I also was able to, like I said, shadow respiratory, because we get a lot of respiratory patients on that unit, be it if they have a BiPAP, be it if they have a CPAP, if they have a ventilator, things of that sort. So I was able to shadow respiratory, and I was able to get familiar with vents, the different settings. I was able to just go over different oxygenations, ABGs, just when a patient would be on OptiFlow versus high flow. Definitely the vent settings, they helped me with a lot. They helped me a lot with the vent settings, the BiPAP settings, CPAP. We went over everything. We went over trach patients, just, you know, changing the trach collars and everything, and just trach care all together. And it was a very, very interesting experience. Now, we were in the medical ICU for that. Respiratory always responds to code. So one of the patients on my unit, actually, they did code, and respiratory responded to it, and I was there. So it was really, really interesting. And then also, like I said, being in the honors program, I was able to shadow a nurse practitioner, which was very interesting. She was a bariatric nurse practitioner. So during the day, we're in surgery. We did 3 surgeries at Huntersville Hospital, which y'all know I'm familiar with. We did 3 surgeries. And then after that, we ended the day in the office. So it was very, very interesting seeing surgeries. And they were like harmless bariatric surgeries, just weight loss surgeries. But I think being in the clinic with her and her being on those calls with the patients, it kind of like opened my eyes a little more to like see how much their diet has to change and how much they exercise, and just lifestyle changes, and the doctors just following up on what medications they were taking, and just like everything that they have to go through for the lifestyle change, because that's a big surgery. All that fat they were cutting through, and it was just really interesting. I was in the OR, and they were just telling me like, keep your hands on your boobs, like you know, you can't drop your hands below, and just being in this sterile surgical environment. I gowned in. This is very, very interesting. So that was really cool. And then the office part was even cooler, just to see like the transition after their surgery and how patients are tolerating after their surgery. So very, very interesting, y'all. So right now I am full-time in the intermediate ICU. I'm working there full-time, and I love it. And I like it so far as going. I'm learning a lot. I'm learning time management. I'm learning critical thinking, critical skills. So it's going, y'all. It's really, really going. And yeah, that's pretty much where I'm at with it. I will continue to keep y'all updated on how everything is going. So I was able to graduate residency, and I was able to get a certificate for my residency graduation. I was able to get a couple goodies. They gave me my own jacket. I would show y'all all this, but it has my company's name on it, and I try to keep my company separate from YouTube. I don't want no issues with them. I have the social media policy, so I try to keep it very, very separate. But I was able to get a jacket and like little goodies and things of that sort. So it was very, very nice. And yeah, I just love that I was able to go through all those rotations and have my own experience. It was awesome. So yeah, I definitely recommend, if you are a new grad nurse and you just want to see like all different types of nursing and all different, if you just want to be wide-eyed and just get the experience, then I definitely recommend going into a residency program. Even if you have a specialty, like you want to do like ICU, for example, like they do have you can go to medical ICU, you can go to neuro ICU, like so many different rotations, cardiac ICU, so many different just plans and different places that you could go, and just different things that you can see. And I think that was my biggest thing as like a new nurse. Like I just wanted the experience. I just wanted to see, I wanted to be challenged, and I wanted to be uncomfortable. And for the last year, I was definitely uncomfortable compared to now, just being on a unit, you know, just working every day with the same people. And nothing's wrong with that, because like the patients always are going to change, but it is different. I kind of miss rotating every few weeks. I really do miss that, especially now that I'm a staff nurse on a floor. But I have a really good team. I work with a good team. Everybody's there to help each other. And I think that's the biggest thing in nursing. Like teamwork is dream work in nursing. So hey y'all, that is that. So I've been back on that unit since October. It's been going. So that's pretty much my experience, y'all, with the residency. I was able to, like I said, shadow, see so many people, get so much experience, and I 10 out of 10 recommend. It's been great. Yeah, so that's pretty much all I have for today. We'll continue to keep y'all updated. If you have any questions, please comment them down below. Please like, comment, and subscribe, and I will talk to y'all later. Bye.